Congenital heart disease, or CHD, is a type of heart problem that is present at birth. It is a condition that can affect the heart's structure and function right from the start of life. It affects the structure of a baby's heart, which can lead to complications if not properly managed. CHD can involve the heart's walls, valves, or blood vessels, each playing a crucial role in the heart's ability to pump blood effectively. These defects can disrupt the normal flow of blood through the heart, causing it to work harder than usual. This can lead to a variety of health problems, ranging from mild to severe, depending on the nature of the defect. CHD is the most common type of birth defect, affecting many families around the world. It affects nearly 1% of all live births, making it a significant concern for pediatric healthcare. There are many different types of CHD, each with its own set of challenges and treatment options. Some are mild and require little or no treatment, allowing children to lead normal lives. Others are more serious and may require surgery or other procedures to correct the defect and improve heart function. The exact cause of CHD is often unknown, making it a complex condition to understand and predict. However, there are some factors that can increase a baby's risk of being born with the condition. These include genetic factors, which can be inherited from parents, maternal health conditions like diabetes, which need to be carefully managed during pregnancy, and certain medications taken during pregnancy, which can have an impact on the developing heart. While the thought of your child having a heart condition can be scary, remember that early detection is key to managing CHD effectively. With proper medical care and regular monitoring, children with CHD can live long and healthy lives, enjoying their childhood to the fullest. A healthy heart acts like a pump, efficiently circulating oxygen-rich blood throughout the body. However, CHD disrupts this vital process. The heart may have to work harder to pump blood, leading to various health challenges. If blood flow is restricted or abnormal, it can affect the body's oxygen supply. This can lead to symptoms like shortness of breath, fatigue, and poor growth. In some cases, CHD can also increase the risk of heart failure or stroke. The severity of these impacts depends on the type and severity of the CHD. Some children may experience only mild symptoms, while others may require ongoing medical management. It's important to remember that every child is different, and treatment plans are tailored to individual needs. Understanding how CHD affects your child's heart function and overall health is crucial. This knowledge empowers you to provide the best possible care and support. As parents, you are your child's first line of defense. While regular medical checkups are essential, knowing the early warning signs of CHD can make a world of difference. Keep a close eye on your child's behavior and appearance for any unusual signs. One of the most noticeable signs is a bluish tint to the skin, particularly around the lips and fingertips. This is called cyanosis and indicates low oxygen levels in the blood. Rapid breathing or difficulty breathing, especially during feeding, is another red flag. Infants with CHD may also have trouble feeding and gaining weight. They might tire easily during feeds or sweat excessively. If you notice your baby sweating more than usual during feedings, it's essential to consult your pediatrician. Additionally, observe your child for signs of fatigue or lethargy. Checking your child's pulse and heart rate at home is a simple yet powerful way to monitor their heart health. It allows you to detect any irregularities early on. Don't worry, it's easier than you might think. To check the pulse, gently place your index and middle fingers on the inside of your child's wrist, just below the base of the thumb. Apply slight pressure until you feel the pulse. Count the beats for 15 seconds and multiply by 4 to get the heart rate per minute. You can also check the pulse on the side of the neck, just below the jawline. Again, count the beats for 15 seconds and multiply by 4. It's essential to note that a child's heart rate varies with age, so consult with your pediatrician for a normal range. Section 5. Observing breathing patterns and skin color. In addition to monitoring your child's pulse and heart rate, paying close attention to their breathing patterns and skin color can provide valuable insights into their heart health and overall well-being. These simple yet crucial observations can alert you to potential problems early on. Observe your child's chest movements while they are sleeping or resting. as this can be a good indicator of their respiratory health. Notice the rise and fall of their chest with each breath, and take note of any irregularities. Infants with CHD may have rapid breathing or difficulty breathing, especially during feeding or exertion, which can be a sign of distress. As mentioned earlier, a bluish tint to the skin, particularly around the lips, fingertips, or toes, is a sign of cyanosis and indicates low oxygen levels in the blood, which is a serious concern. This is a serious symptom that requires immediate medical attention to prevent further complications. By being attentive to your child's breathing patterns and skin color, you can become familiar with their normal baseline and detect any changes. This will help you detect any deviations from the norm that may warrant further investigation by a medical professional, ensuring timely and appropriate care for your child. Section 6. Seeking immediate medical attention. While many symptoms of CHD are subtle and require careful observation, some symptoms warrant immediate medical attention. It's important to be vigilant and aware of these critical signs. If your child exhibits any of the following signs, don't hesitate to seek help. Immediate action can make a significant difference in the outcome. Difficulty breathing or shortness of breath is always a cause for concern. This can indicate a serious issue that needs prompt medical evaluation. If your child is struggling to breathe, call 911 or take them to the nearest emergency room immediately. Time is of the essence in such situations. Similarly, a bluish tint to the skin, lips, or nail beds, cyanosis, is a medical emergency. This discoloration can signal a lack of oxygen in the blood. Loss of consciousness, even for a brief period, should never be ignored. It can be a sign of a serious underlying condition. If your child faints or loses consciousness, seek immediate medical attention. Quick response is crucial to ensure their safety and well-being. Lastly, if your child has a heart rate that is consistently too fast or too slow for their age, it's crucial to consult with a medical professional. Abnormal heart rates can be indicative of underlying heart issues. Remember, it's always better to err on the side of caution. Trust your instincts and seek help when in doubt. Early detection and intervention are crucial for the best possible outcomes for children with CHD. Prompt medical attention can lead to better management and treatment of the condition. Section 7. Importance of early diagnosis and regular checkups. Early diagnosis of congenital heart disease, or CHD, is crucial for improving outcomes for children born with this condition. When CHD is detected early, treatment can begin sooner, which can prevent complications and improve long-term health. Regular checkups with your child's pediatrician are essential for monitoring their heart health and detecting any potential problems early on. During these checkups, the doctor will listen to your child's heart, check their pulse and blood pressure, and ask about any symptoms you may have noticed. Early intervention is key to managing CHD effectively. Treatment options for CHD vary depending on the severity of the condition, but may include medication, surgery, or a combination of both. With proper care, children with CHD can live long and healthy lives.